So tell me about scoliosis with adults. Like if you're in your 60s, you've had it your whole life, maybe now it's causing pain or causing problems or side effects. What are some of the treatment options? And how well do they treat?
Well, scoliosis in adults usually comes from disc degeneration.
Okay.
So then it's the scoliosis because of curvature, nerves start getting pinched and patient get severe back and leg pain.
Oh, okay.
So it's a little different from scoliosis in kids, which is just a deformity problem. So those patients, we can apply this minimal invasive technique. Rather than big open surgery, we can help adults with scoliosis using the OLIF, the minimal invasive spine.
So instead of opening them up, you're able to go minimally invasive in there, straighten out their spine, and
get rid of their pain.
And get rid of the pain.
Yes.
Is that right? And how old can you be to get that? I mean, if you're fairly healthy, I guess.
Typically, patients can be up to 80.
Is that right?
Yeah,
so
you don't want to do open surgery, for example, an 80-year-old with scoliosis, but we can apply this minimal invasive technique to 80-year-olds.
So an 80-year-old person, and what are the symptoms? Like, how do you know that the scoliosis is causing your pain, your pinching of the nerves? Just through imaging?
Through imaging, plus they cannot stand or walk. They can only sit, and they can maybe walk 10 yards. They have to sit down again.
Okay.
Because of scoliosis and pinched nerve. So if you fix them with surgery, preferably to the minimal invasive way, then you got the problem solved.
And so you've had good results, like people that are like saying, I'm pain-free. People that could walk.
That's right.
In Costco or whatever they want to do.
Yes, they don't have to sit down. They don't have to look for a chair to sit down. They can continue to walk.
Now with this minimally invasive scoliosis surgery, what's the downtime there? If everything goes right.
Everything goes well, right. We keep the patient in the hospital 1 or 2 days. Typically scoliosis surgery in elderly, they might be in a nursing home for 1 month and in the hospital for 2 weeks after the surgery. But with this minimal invasive technique, they're in the hospital for only 2 days and they go straight home.
And they're good?
They're good.
How soon could they start walking and getting around?
Right away, right after the surgery. Same day.
And what's it called? What kind of... Because look, somebody watching this that's an adult with scoliosis that's pinching in on nerves or whatever, they've been told elsewhere, too dangerous at 80 years old, too dangerous at 70 years old to do the surgery.
Open surgery.
Right, open surgery.
Because they don't know about this minimally invasive technique we have. We can apply this minimal invasive technique, solve the problem with much less, morbidity.
Now, is that true? I mean, there's only like 30 guys in the United States that are trained to do a scoliosis surgery with this minimally invasive technique.
In this using this particular technique, there are other minimally invasive techniques, which is called XLIF. I've done thousands of them.
Okay.
And that's more invasive, higher complication, longer hospitalization.
So this is truly a minimally invasive.
This is truly minimally invasive as opposed to the other technique. I've done thousands of that before.
Are you fusing things when you go in there with scoliosis?
Yes, you have to use the screws and rods and all of that.
And you could fit them in the tiny little holes?
Exactly.
Really? Okay. I'm going to have to go down there and see you guys do this one of these days.
I
think I've seen some of the videos.
You should watch it.
Very nice.
Yeah.